Hello there, welcome to Yodo. I'm Dr. Sarah Bone. This video is a continuation of the topic of connective tissue diseases. Today, I'm going to give some specifics about just a few of the many various types of connective tissue diseases and what end-stage disease might look like. There's an introductory video that talks about what connective tissue is, and you can go to that one if you missed it. A connective tissue disease is not a typical diagnosis for someone to be receiving palliative care, but it sure can be. Patients with symptoms from advanced connective tissue disease may benefit from an evaluation by a palliative specialist. Palliative care can assist with symptom management, provide suggestions for improving quality of life, and help provide a better understanding of the disease process, as well as a guide for goals of care discussions. There are times when a connective tissue disease is listed as the primary diagnosis for a person enrolled in hospice. A connective tissue disease can cause organ damage so severe that it will lead to a limited life expectancy, and patients can be provided that extra help of hospice, that's that in-home service. And during my career, I have cared for patients that have had a primary diagnosis of a connective tissue disease. Generally speaking, pain and joint swelling, often with progressive joint deformity, are the predominant symptoms of each of the connective tissue disorders. Gelling phenomenon and Raynaud's phenomenon are common as well. For some patients, the early symptoms include general complaints such as anemia, weakness, fatigue, poor sleep, depression, anxiety, appetite and weight issues, and abdominal symptoms, not just limited to pain, cramping, or bowel irregularities, but other abdominal issues also. And skin issues can occur. Sun sensitivity, thickening, scarring, rashes, or hair loss might occur. Although these symptoms may not seem like they're life-threatening, they do impact a person's quality of life and their activity. We'll talk about a few specific connective tissue diseases and what end-stage disease may look like. The first group that we're going to go over will be those that are inherited. Not all family members will be affected, and those that are affected may not have the same expression of the disease. Thus, not all family members are affected the same way or to the same severity. As a viewer brought the question, I will talk about Ehlers Danlos first. There are over 10 specific disorders within the Ehlers Danlos class of connective tissue diseases. This is characterized by hypermobility of the joints, delicate skin that is very stretchy. The skin can be so delicate that sutures can easily pull through. Commonly, skin texture is velvety. The skin is overly susceptible to dryness, can be quite fragile, is slow to heal, and patients are at a higher risk for bruising. Ehlers Danlos patients have an increased sensitivity to cold, and the severity of Raynaud's can really be advanced and be severe for some patients. Some patients can have tapered look to the end of their fingers, as there's risk of those fingers becoming shorter over time because of the recurrent poor circulation. Abnormalities of the nails are common in Ehlers Danlos patients, and the nails can be thickened and have ridges and be abnormally shaped. Thus, the use of any chemicals that might reduce blood flow, such as tobacco, will also place that patient at an even higher risk of poor circulation problems and, again, increase in their pain. The effect of nicotine resulting in the narrowing of blood vessels will typically last for several hours in a patient with Ehlers Danlos syndrome. Spasming of the blood vessel can become so severe that there's actual risk for permanent damage to the fingers. There's significant risk for joint dislocation in Ehlers Danlos patients, as the ligaments are weak and very flexible. Thus, falls and injury can occur easily, and joint dislocations are not uncommon. As patients cannot fully rely on their tendons and ligaments, they must maintain good tone of their muscles and practice their equilibrium skills. Maintaining strength and practicing balance daily is a very important part of these persons' lives. For most Ehlers Danlos patients, life expectancy is not anticipated to be shortened. However, this changes if an injury occurs and it's severe, or if there's a problem with wound healing, including wound breakdown or an infection. For some Ehlers Danlos patients, vascular events may occur. As the blood vessels can be affected in Ehlers Danlos patients, the patient can be at risk for multiple types of vascular-related events, including stroke or heart attack. Some Ehlers Danlos patients can have heart valve issues, Others may have lung changes or digestive problems. So it's not a connective tissue disease that's to be taken lightly, and wise choices regarding lifestyle and activity that is safe is very important for these folks. More commonly, the risk of a cascade of events, starting by the Ehlers Danlos patient having a problem and maybe a fall, and then ending with the patient having a different medical issue entirely, is quite high. An event such as a severe fall with injury or a surgical procedure that did not heal well can alter their anticipated lifespan. Having difficulties with activity and not staying in good fitness can also alter their trajectory and contribute to earlier than anticipated decline. Simple care that adds up to a better and longer life include healthy living, making good food choices that promote nutrition, choosing good footwear that's appropriate, supportive, and comfortable is really important for these patients. We want to be able to ensure their ability to be sure-footed and stay as active as they can and be safe. Being cautious with their exercise and choosing their sports activity carefully is also important. Getting good sleep with supportive pillows and mattresses really matters for these folks. And of course, maintaining good mental health practices will also add up to better health for these folks. So now let's discuss another well-known connective tissue disorder in this same class of the inherited connective tissue diseases, and that's Marfans. In this disease, connective tissue does not grow and develop normally. It may affect bones, ligaments, eyes, and the heart. The heart effects and changes in the aorta present the greatest health risk for these patients. Marfans patients are often very tall with long fingers, as the connective tissues do not have the same structure as in other people. Bones, ligaments, and cartilage grow longer and may be softer than normal, and therefore more prone to injury. Connective tissue in the eyes is commonly affected in Marfans patients, more so than in other connective tissue diseases, with the result that these patients can have a higher problem for risk with their lenses, such as myopia, early cataract formation, or lens dislocation. So this group has a lot of eye effects, and even glaucoma can be more predominant in this group. The heart muscle, valves, and aorta can be affected, becoming weak and inelastic too early in life. The normal process of aging for the heart seems to occur prematurely by several years. Heart valves may not open and close correctly. The aorta may not be as resilient as it should be, and it's not as stretchy with the ability to bounce back like it should be. There are worrisome and common risks for Marfans, and these just name a few of these. Because Marfans patients are often very tall, the typical tall height of basketball players are often evaluated for this disease. Life expectancy of patients for Marfans has improved significantly since the 1990s due to increase in knowledge and understanding of the disease, as well as medications now available that reduce risks and their threat for these issues to occur. Again, like the cascade discussed with Ehlers Danlos patients, if Marfans leads to a heart issue, then life expectancy may become shorter. The patient that has a connective tissue disease that results in damage to the heart or aorta, that's a significant risk issue for them. Thus, patients can develop end organ damage and have advanced heart or vascular problem that's life-limiting, and although it's not exactly from the Marfans, it's definitely caused by the Marfans. A connective tissue disease with a very worrisome prognosis for parents to learn about is Osteogenesis Imperfecta. This inherited disorder is hallmarked by brittle bones. This can be quite variable, with some patients having nearly normal bone density and others with extremely fragile bones. Some patients can have numerous fractures by the time they're into their teens. This is classified into one of nearly 20 types by the specialists that care for patients with osteogenesis imperfecta. Each type of this disorder carries a particular classification system. The mild form of this disease does not carry a significant change of life expectancy. However, patients are at significant increased risk for fracture. Thus, depending on the fracture location and severity, this will affect the patient's life expectancy. The severe form of this disease typically is very devastating, with life expectancy that could be limited to less than a few years. Infants could have broken bones before birth, and may have fractures occur during the birthing process. This connective tissue disorder has a broad spectrum of outcomes depending on the specifics of the particular type of osteogenesis imperfecta that the patient has. Typically, the pediatrician is going to be the first one to have the tip-off for this, but it could be genetic in the family, and so some parents are prepared for this. These are three of the more common inheritable connective tissue diseases. They're primarily bone, cartilage, and joint-related diseases, but because the connective tissue cells are in blood vessels, heart valves, and hold the eye lenses in place, there's a real risk for a patient to have damage to other parts of their body, such as the circulatory system, heart, and eyes. Although these chronic illnesses are progressive, they are treatable. The advancing changes can be slowed, so it's important to identify the disease early. Each of these can certainly impair good mobility and reduce the number of pain-free days for a patient. Over many years of having a connective tissue disease, the disease can affect activity, mobility, and often lead to daily pain. Making wise choices, living a healthy lifestyle, eating well, and having safe exercise are things that the patient can do to help themselves. Physicians have new medications that will help mitigate the risk for Marfans patients and for Ehlers Danlos patients. I really can't speak to osteogenesis imperfecta because that is not my area of expertise. Please watch for the next video in this series about connective tissue diseases. I appreciate your help with this channel, making it grow by subscribing and passing this forward to others. If you have a topic that you would like discussed or a question, please leave it in a comment below. Live each day to the best. Bye for now.